Welcome back to the show. You know, here on the Morning Blend, we love introducing you to new guests, especially new guests that have new treatments. So, men, this one is for you. Listen up. We are joined now by South Bay Medical Clinic, Andrew Reinhardt. Andrew, I'm excited to chat with you today because you've got some new treatments you want to pass along. Talking about some things that I don't know if I want to talk about, but men really don't like talking about it. Andrew, you're talking about it a lot because you want to help people.
We are talking about it. This is erectile dysfunction, which is kind of the icky subject. But when it comes to ED, there has been pills, medication, and of course, side effects up until now. South Bay Medical Clinic has a treatment called acoustic wave therapy. Here's what's interesting. ED is caused by damaged, aging, or blocked blood vessels. It's kind of a blood flow issue. Our treatments and our technology is clinically shown to open up and regrow those blood vessels. So we're improving blood flow. We can get a guy back to normal and natural function in the bedroom. Here's the key word: spontaneity. Comes back, no needles, no injections, no pills, and that means no more of the nasty side effects.
Okay, I get the no needle part, but medicine, I feel like that's more of the common thing that you do hear about when you treat ED. Why do men want to stay away from medicines? What have you been able to hear?
They could tell you all about the side effects, the headaches the next day. They call this the Viagra hangover, the blurred vision, the achiness, and almost flu-like symptoms. So there's all that. And then there's a large percentage of guys that the pill just doesn't work on at all. And lastly, they don't want to have to pre-plan those intimate moments. They want things to work like they used to, naturally and with spontaneity. And as far as I know, our technology is the only thing that can restore that.
You know, sometimes men want to worry about safety, and maybe you're thinking about making sure that you're watching those headaches or a cold
Yeah,
symptoms. But when it comes to a guy talking about their member, they want to make sure what they're doing down there is safe. Have you been able to do
absolutely.
any clinical studies with this?
There have been extensive clinical studies done on our technology, everybody from Cambridge to the American Urological Association, therapeutic advances in urology. I could go on and on. You could certainly go to the science page at southbaymedicalclinic.com. But I will say, American Urological Association recently said that this treatment is, quote, effective, safe. They even said the word revolutionary. So this really is a breakthrough in the treatment of erectile dysfunction.
Andrew, when we first started this segment, we were a little tongue in cheek about saying, men don't like talking about it. I didn't want to talk about it, but
Yeah.
it is a real problem. And I'm assuming that there's some men out there that don't want to pick up the phone and try to treat this either. Who is the ideal patient for you, and why is now the time for them to pick up the phone?
When a guy gets erectile dysfunction, he typically does nothing at all. For the exact reasons that you said, he doesn't want to address it. It's a little bit embarrassing, but I will say this, and I hate to say it: ED does not fix itself, guys. It doesn't cure. So if you're experiencing some early symptoms, it will probably get worse before it gets better. Now's the time to treat it, because in 2 to 3 weeks, that's the average duration of our treatments, we can restore normal function in the bedroom. So think about that. 2 to 3 weeks from now, throw the pills away and get back to those younger years. It's much easier to fix when you've got some function left in the bedroom.
Man, well, Andrew, I'm glad you are joining us today talking about this for the men at home. And right now, too, you've got a special offer, just kind of a welcome gift, right, to the Morning Blend and our viewers?
We do, guys. If you're struggling with erectile dysfunction, or if your man is struggling with erectile dysfunction, bring it up and communicate. Call us now. We are doing so much for free. To those that pick up the phone, we will do the initial assessment exam, the blood flow ultrasound, even totally free. We're going to throw in a little special gift that produces instant results in the bedroom. The phone number is on the screen. Everybody gets it for free if you call now.
And even like you said, women, you can call too for your man. Nice meeting you, Andrew. We look forward to chatting with you more.
Thanks for having me.